Measles, it's one of the country's most contagious diseases, and it's surging across the nation and now here in Arizona. And for the first time during this outbreak, someone in Maricopa County has tested positive. 12 News journalist Maria Stobbs is joining us now in studio with the details. Maria?
That's right. Maricopa County has seen measles exposures in recent months, but this is the first time confirmed measles case in a Maricopa County resident during the current outbreak. Now, I spoke with one Valley woman who remembers what life was like before a measles vaccine and why this outbreak feels so familiar. Arizona native Marjorie Condor has lived through nearly a century of history.
I grew up during the Depression and then the Second World War.
But one memory still stands out.
I had the measles when I was a child, but then every child did then because there were no vaccines then. I was very sick. I remember being very sick.
Years later, she was dealing with it again. One of her kids, who was 4 months old at the time, had measles in the 1950s, just years before the vaccine became widely available.
He had this high fever for 4 days. He hardly ever slept. It just scared me to death because I didn't know what was happening until he broke out in the measles rash.
For her family, the nightmare eventually ended, but for hundreds of Arizonans, it's back. State health officials say more than 200 measles cases have been reported in Mojave County since last August. 97% of all patients were unvaccinated, and now someone who lives in Maricopa County has measles.
Our concern is that it expose other people.
Dr. Nick Staub with Maricopa County says the patient is an adult who recently traveled overseas.
Travel, especially international travel right now with so much measles transmission in the U.S. and around the globe, is a risk.
And because measles spreads so easily, he says certain groups should be especially cautious. People who are unvaccinated, children under 1 year who are too young for the vaccine, and anyone immunocompromised.
Those are the groups that we think about the most in terms of having severe cases of measles. But again, the best way to be protected is to be vaccinated.
A warning also shared by Marjorie, who has lived it and never forgot it.
Why would you want your child to get that sick? And why would you want your child to spread it to some other child?
Now, if you think you've been exposed or you have symptoms like a fever, cough, runny nose, red, watery eyes, or a rash, health officials say you should call a doctor and get tested for measles. We're live in studio, Maria Stobbs, 12 News.